Troubling news today about the health of Americans. The nation's overall death rate is on the rise, up 1.2% last year, according to the Centers for Disease Control. And a major culprit is heart disease, making a comeback after 4 decades of decline. With us to discuss, our WSJ News editor, Betsy McKay, and Dr. Sidney, director of research clinics with the Kaiser Permanente California Division of Research. Welcome to both of you. Betsy, let me start with you. The rise in deaths from heart disease marks a turnaround from 4 decades of progress against the nation's leading killer. What happened?
Well, it is. It's been, one of the great public health achievements is that since 1969, the death rate for heart disease has gone down about 70%. And heart disease is still the leading cause of death in the U.S. I mean, it's been that way since basically 1910. So the rate has come down precipitously. And this is the first year, 2015, is the first year that it started to tick back up, except for a blip in the early 90s. Researchers are looking at this and saying this is the effect of the obesity epidemic and diabetes, which took off in the 1980s, and it's taken some time to start having an effect.
All right, and Dr. Sidney, we see that the death rate from strokes is also on the rise. Similar factors leading to this. What about the rise in drug use?
Are you talking about illegal drug use or legal drug use?
Either or, both.
Well, I assume you're talking about illegal drug use, and of course we know that there is a major opiate epidemic right now, which is killing, I believe at this point, tens of thousands of people. So that is certainly a major issue of public health attention. Drugs or medications certainly have a role in cardiovascular disease, and they certainly absolutely have contributed to the prevention of heart disease, both heart attacks and heart disease deaths during this 40-year period, and probably particularly much so in the first decade of this century, when heart disease deaths went down by more than 30%, with increasing use of statins that are familiar to very many people, and also increasing use of low-dose aspirin for prevention of heart attacks.
But doctor, it's interesting to me that obesity has risen so substantially in the past 40 years when there has been sort of a concerted public health effort to get nutritional information out there. We can see that the rates of smoking have declined, just visibly fewer people are smoking.
That's correct. There's certainly a vigorous discussion of what's going on. There's a belief that a de-emphasis, or more of an emphasis of having low-fat diets and increasing carbohydrates may be a major contributor to this. And we also see that there, in general, has been then a decline in physical activity, and physical activity is certainly a huge driver, or physical inactivity, I should say, and sedentary activity are huge drivers of both obesity and of heart disease and other cardiovascular diseases.
Very good point. Now, Betsy, deaths seem to be rising, though, almost across the board. The CDC says 8 of the top 10 leading causes of death are up. Is that correct?
That's correct. We focused on heart disease because it's the leading cause of death, and heart disease and cancer together make up almost half of the deaths overall. But the fact is, so any shift in either one of those, and particularly heart disease, is going to have a major effect. And again, this had started to happen, but really didn't rise until this past year. But 8 of the 10 leading causes of death experienced increases in their death rates. And that includes the category unintentional injuries, which includes drug overdose deaths. We see a lot of that now. That the use of heroin, fentanyl, prescription opioids, and the effect that that's having on the population is dramatic. what happens is, as long as heart disease deaths and cancer deaths are still declining. As long as those were declining, increases in some of these other categories weren't offsetting them. But then when you start having problems in heart disease, the problems elsewhere become more pronounced. So diabetes deaths are on the rise too, kidney disease, Alzheimer's, and suicide, another what is called, deaths of despair. So it's a pretty bleak picture. And I think we should just add here that for a wealthy country like the United States, consistent declines in mortality are to be expected. Mm-hmm. And when you have a reversal, it's very unusual for a rich country.
Well, it's also interesting because the rate of old age mortality hasn't changed significantly. It's the death rate among middle-aged Americans that's significantly on the rise. Doctor, quickly, we don't have a lot of time, but what can be done to reverse this trend?
Well, this calls for very important emphasis on preventive measures. We really don't spend enough money on prevention. We spent a lot more on prescription medications and technologies and their development. But we have to prevent disease starting really in utero with good diets and habits by mothers, starting in childhood and going throughout the life course. These diseases take decades to manifest themselves, and prevention starts in childhood. Certainly a concern now with the potential that there might be some rollback on the Affordable Care Act, which was funding preventive activities, that might tip things further in the wrong direction.
All right. Thank you both, Betsy McKay and Dr. Stephen Sidney, for that. Thank you.
Thanks.
Thank you.